Welcome to Bad to the Bones, the podcast where we discuss everything related to orthopedics, joint health, and living an active lifestyle. Hi, everyone, and welcome back to another episode of Bad to the Bones, where we dig deep into all things spines, bones, joints, and everything in between. I'm your host, Debbie Rohde. Joining me today is Dr. Joseph Zerbo. He is a board-certified orthopedic surgeon, spine surgeon, and interventional pain management with over 35 years of experience in evaluating and treating options for back and spine conditions, as well as injuries. Dr. Zerbo brings a human, compassionate, just a refreshing, real-life feel to the spine care, and we're really thrilled to have him at Premier Orthopaedic Associates. So welcome to the show, Dr. Zerbo.
Thank you very much, Debbie.
Yeah,
it's great to be here.
Yeah, we're looking forward to this conversation. So today, we want to just talk a little bit about your approach and why Premier, and just dig a little bit into the back injuries and treatment options that are available. Let's start with, you recently joined Premier. You've got 35 years of experience. What led you into this specialty to begin with?
Well, are we talking specifically my orthopedic spine specialty?
Sure.
Well, that was a long time ago, and I knew from the beginning that orthopedics and spine is unique. We deal with a lot of great tools to help people with and get them back on their feet and get them moving. So that clearly was my motivation for this specialty, to get people back to their activities.
Okay. So was that something you knew before you got into your residency?
I knew it from day one in medical school.
Oh, wow.
And I don't know how. I
Yeah.
never had any orthopedic injuries, never had any back injuries, but
Okay.
I knew very early days of first few months of medical school, this is what I was going to do.
That's awesome. That's really good. And what led you to Premier? How did you get on our team here?
Well, I've been practicing in Atlantic and Cape May County since 1988. And I remember when Dr. Dwyer started the practice,
Yeah.
and I knew they were practicing really good medicine in the area. And his practice just exploded
Yeah.
with providers. And I initially was in a larger orthopedic group, and it seemed to dwindle down to just a few practitioners, till at one point it was just me.
Yeah, okay.
And I eventually realized that this doesn't work. Somehow Tom and I were able to reach out to one another, and it's been great for myself and my practice and the care of my patients.
Well, we're happy to have you here. And today we really want to talk a little bit about, we know that back pain and spine, injuries and such, sometimes they're misunderstood, and there's just a lot of different conditions. So let's talk about the Premier approach and how Premier has this approach of not leaving patients on their own, so to speak, that, you from the moment they come in for an appointment, you are by their side and really looking to understand their complex injuries. Can you talk a little bit about your approach from an appointment?
Well, the one benefit of Premier is that despite the fact that there are many roofs throughout the area geographically, all of the physicians and clinicians are really all under one roof.
Yeah.
So whether it's the therapist, the occupational medical specialist, the non-surgical orthopedic doctors, the surgical orthopedic doctors, the pain management physicians, as well as the spine surgeons, we work really close together. It's very common. We'll have mutual patients that we speak to each other with what it's the best care, the best direction of treatment.
Yeah.
And so that's a huge benefit. And also, when I was not with Premier, if I wanted a patient to see, let's say, a pain management physician, and go to another practice for a diagnostic study, they were really on their own to figure out how that happens. Whereas having it all under one roof, they leave the office knowing who they're going to see and when, and who's going to take care of them, and that I individually and personally know that.
That really puts the patient at the center of the care, and I think it really makes them feel valued, and heard and seen.
It takes a lot of stress off of them knowing that they're leaving the office, the appointment's made.
Yeah.
the doctor they just saw knows the doctor he's going to, and the appointment is scheduled.
Yeah.
In today's world, it's not easy to get these appointments in an efficient manner.
Yeah.
And fortunately, under our roof, it happens very swiftly.
Can you talk a little bit about why it's so important to get a good physical history and physical exam of a patient? Because we know sometimes when a patient comes to you, this might not be their first appointment seeing a back specialist, and they're probably sitting there saying, how many times do I have to explain this to people? I already know what's going on, but you still need to do that. Can you tell us a little why that's important?
The key for treating the individual with a back problem, or really any orthopedic problem for that matter, is a really accurate diagnosis. You have to nail it, and you have to nail it with a history and physical exam.
Yeah.
And so that history, which can be fairly lengthy and involves a lot of very specific questions, is continually, in my mind, ruling in and ruling out diagnoses.
Yeah.
The physical exam further adds to those diagnostic possibilities, as well as ruling out certain ones.
Right.
And then the diagnostic study, whether it's x-rays, CAT scans, MRIs, EMGs, can confirm my diagnoses. But if we really lack on spending the time with the individual on that history and physical exam, and okay, your back hurts, let's shoot you off, get a quick MRI, and let's see what's wrong.
Right.
Usually is the beginning of a failed experience or in a failed treatment program. It begins with the history and physical and the diagnosis. And really, you just can't depend on anybody else providing that for you.
So if a patient comes to you who already has an MRI and says, I'd like to just get a second opinion, I'm just feeling a little unsure about the treatment options that I was given, how do you approach that?
Well, I believe, especially when it comes to any form of invasive treatment, including surgery, a second opinion should really be on everybody's consideration. Fortunately, in the practice, we have so many doctors being involved in the patient's care.
They can get a second opinion right under the roof.
They're going to have several opinions without having to even ask for it. But it's just really important for myself as the surgeon to really get a handle on I can't fix their problem if I don't know what their problem is, because the MRI does not tell me what their problem is.
Yeah.
It may tell me multiple abnormalities in their spine that may just be part of that aging process or wear and tear process.
Yeah.
So it's really important for me to hear from the individual what their problem is so that I can address that.
Yeah, and I know just from, being around the practice that patients learn that back pain does not always come from the back, right? So sometimes, what we feel like it's coming from the back, it's not. So can you talk a little bit about how you explain that to patients when they are really set on, no, it's my back, it's my back?
So they're there for my history and physical exam, and so they're getting a hint of where things may be leading.
Yeah.
And so I've been with Premier since the first of the year, and we do have several total joint replacement doctors in the practice. And I'm going to tell you, when people come to me that have seen and have had treatment for their lower back, about once a month I'm sending them to get a total hip replacement because that's their problem.
That's interesting.
And so me operating on their lower back would be a massive failure.
Yeah.
When it was all about the arthritic hip that they were dealing with.
Yeah, that's interesting too, because my older brother, he sits all day long and he's a couple years older than me, and he swore he had hip issues, was finally diagnosed with spinal stenosis. And so, to me, I was like, wow, that's, it's interesting because like we're talking about, it's not always coming from the back, right?
There's a lot of overlap in symptoms and the cause of those symptoms. And so we go back to that history and physical where it's vitally important.
Yeah.
Yep.
Yeah, well, in his case, it was coming from the back. But what I was trying to say is, with hip issues, he thought it was a hip. So you really never know where it's coming from.
Yeah, had he got a hip replacement, his back still would have been, it wouldn't have gotten any better.
Right,
He still
exactly.
dealing with the pain.
And there's such an emotional side to patients with back pain. I mean, it really does impact the quality of someone's life. Let's talk a little bit about that and how you deal with that type of emotional side of treatment with patients, how you address that.
Well, dealing with a bout of back pain, one is very common. It's one of the most common diagnoses. Americans, U.S. adults, go to a doctor.
Yeah.
And dealing with back pain and trying to move on with your day is difficult.
Yeah.
And you carry that pain. Sometimes you can push through it, but it is a heavy weight and draws on you in every ounce of your body.
Right.
And so it's good to grasp really quickly that we have a diagnosis at hand, we have a treatment program, and they're going to get better.
Yeah.
And so for the individual to know that they have a problem that can be addressed, is going to be addressed in an efficient way, is the best way to handle how they feel about dealing with this problem.
Yeah,
Sure.
that sounds like a really nice approach, because I personally feel like when a patient is heard, that's like half the medicine, right? I mean, that's when you know you have a really good physician who's on your side and not just trying to prescribe things or just take you down a path that's a path you've been down before, right? How about conservative, cutting edge treatment options today? There's always evolving technology and different treatment options. What are you most excited about with treatment options for back and spine?
So there's been a big explosion in these conservative care treatments. A lot of it has been with, especially in our pain management physicians, with a lot of the minimally invasive injection techniques, regenerative types of intervention for people with problems with their lower back. From a surgical standpoint, there's also been a big explosion in the surgical techniques with minimally invasive techniques, computerization in the actual operating room with diagnostic imaging to make sure that when we're doing surgery, we know exactly where we are at all times, especially with the spinal implants that we occasionally have to use.
Right.
And it's only growing as well.
So surgery seems to be a very last resort, right? I mean, it's not something you really encourage your patients to try interventional options. What if they persist and say, no, I've tried those at another practice. I just want surgery. I want to get this done. How do you approach that?
Well, you need to make sure that the abnormalities, so one, okay, their diagnosis has to be accurate.
Yeah.
The history and physical has to match up with the diagnostic studies. It shows abnormalities.
Yeah.
And some diagnoses are very amenable to surgical treatment. And I explain that to the individual. This is the problem. This is what you should expect. And they should expect to see that success 95% of the time.
Let's talk about some of the early warning signs and maybe some red flags. A lot of times we put off seeing a doctor with our back pain. We just think, I just did a lot of heavy lifting or cleaning or played a sport, what have you. What would you say are some of the early warning signs that should really prompt someone to get some medical attention?
So there are several that are very serious problems that should be addressed on an immediate basis. So if somebody, for example, had a fall and they really have severe back pain, you don't walk it off. You go and make sure you see a doctor and get an x-ray, because you could have fractured one of the vertebrae in your spine. That's how it's going to show up.
Yeah.
When somebody has, for example, an atypical fever, that, and I'm not saying that they have like an infection like a sinusitis or a sore throat and they have a fever and their back bothers them a little bit, but all of a sudden they have pretty severe back pain associated with fever. That's where you want to see a doctor, because in a rare case there can be an infection in the spine.
Interesting.
That can occur. A big one is, and this is one you don't even stop it, go. You go right to the doctor's office. You go to the hospital if somebody's lost control of bowel and bladder function. That's a really serious problem, and it can happen. We see that. And then, of course, in not so much of an acute emergency, but so if somebody's having neurologic symptoms, so the nerves in the lower back control the legs. If somebody's having neurologic symptoms with numbness or weakness in the leg, they're stumbling, they're tripping, that's something to be concerned about. That's not just going to go away by itself. It needs to be seen by a doctor. And of course, if the back pain's lingering and is just not getting better,
Yeah.
it's been a couple weeks, you're taking the Motrin or Advil, it's not getting better, that's probably a good time to make that phone call.
I've not heard about the bowel and bladder loss of control. What are some of the conditions or things that could be going on for that to happen?
So the nerves in the lower back control everything from the waist down, and part of those nerves control our ability for voluntary control of the bowel and bladder. And so that's a true surgical emergency.
Wow.
If I get a call at 2 a.m. that's occurring from the emergency room, I'm getting dressed to take that person emergently to the operating room. So
Yeah.
before the sun rises, that condition is fixed. And it's directly related to usually a very big herniated disc squashing on those nerves, putting pressure on them and actually causing severe injury. The faster we get to that, the better the outcome and recovery is.
So we talked a little bit about some of the advancements that are game changers. Are there any particular techniques, for the spinal cord that you really feel have been a game changer?
So the good news is that change is slow because what we've been doing works.
Yeah.
Most of what we're doing is focus on can we do it a little bit better. And so whether it's intraoperatively with computer systems and the diagnostic systems we have that talk to one another live while we're in the OR is a big advancement. And of course, I'm sure AI is going to work itself into that operative arena to also make things a little smoother, maybe quicker for us as well.
That's great. It's something where it's a slow progression that you're evolving and, just very meticulously maturing and just evolving. So I like to hear that. What do you love most about the human connection in helping your patients in this field?
It's, one of the interesting, as you ask that question, pops in my mind. It's interesting how you can see a person prior to surgery come in and be sore as heck.
Yeah.
And you can see it from head to toe all over the body. And then the first post-op visit, it's like, you have the same name as that person I saw last, but you look totally different.
Yeah.
And they're just a totally different person.
Oh, that's great to hear.
And that's kind of pretty common.
Yeah.
All of a sudden it's a different person. You've taken that horrible pain away. They sense it and they've gotten their life back.
Well, I love that. Yeah. Do you have any final thoughts or interesting tidbits that you'd like to share with our listeners, about whether it's when to seek help or just something you're passionate about in this field?
Well, they should not be afraid about what we might be saying that keeps them from coming into the office.
Yeah.
It's good to know what's going on. A lot of times, again, surgery is a last resort. Very rarely is it necessary, but there are still a lot of positive things that can be done for the ailment, the lower back condition. And so they should not be afraid. And if somebody really does need surgery, the surgery is usually successful. We really know why there's bad outcomes. Bad outcomes begin with a failed or an inaccurate diagnosis.
Yeah.
You do the right surgery for the right problem, and that's really almost a guarantee for success.
Well, it also sounds like if it's anything musculoskeletal, that they should seek, some sort of diagnosis, because as we talked about, it doesn't always mean it's your back. It could be coming from something else. So, right? I mean,
absolutely. And another little tidbit: most patients, individuals. I recommend that getting that second opinion.
Yeah.
And if the first opinion seemed, questionable for you, then you should go with your senses. Go with, how you were treated by everybody in the office, including the physician or the technicians or assistants. If it was very successful for you, you felt like you were thoroughly examined, they looked at your diagnostic studies, that's a good start.
Yeah.
And if that isn't there, then there's something wrong there.
Oh, I like that. Dr. Zerbo, thank you so much for joining us today on this episode. You've shared some really valuable insight, and I hope our listeners out there are understanding, again, that, if you're experiencing bone or joint pain, it doesn't always mean it's coming from your back. It could be coming from somewhere else. So at least schedule an appointment and let's get to the bottom of it so you can get back to living a quality life. If you or anyone that you know is struggling, you're not alone. Let us help you navigate this process. We have a great team under the roof here at Premier, and we have locations across New Jersey, from Deptford to Linwood. We have locations right in your backyard. You can call or text us from 8 a.m. to 5 p.m. at 856-690-1616. Schedule an appointment. We always have someone available, and we know your lives are busy, so texting is always a great option, especially on Mondays. We like that. But until next time, we look forward to having you on our next episode of Bad to the Bones. Stay strong and healthy and enjoy the summer.